Today in cannabis news, the state of New Mexico begins taking submissions for recreational cannabis producers. Colorado's state attorney general asserts that the U.S. Congress must safeguard small cannabis businesses from big tobacco corporate control. And the U.S. federal government and California's gubernatorial administration are looking into medical cannabis use in healthcare facilities. It's Friday, August 27th, and this is your Trichomes Morning Buzz.
Broadcasting live from the Trichomes.com studios in Southern California. It's time for your Morning Buzz. We bring you late-breaking news that keeps you up to date with what's happening in the cannabis industry.
First up, companies eager in being authorized as licensed cannabis growers in the state of New Mexico may now apply immediately. The Cannabis Control Division stated this week that businesses can now begin by using an application form portal online, only one day following the state revealing completed regulations for cannabis cultivators. The portal went up days before the September 1st requirement for authorities to start accepting applications. Officials praised the streamlining of the application procedure, which before required potential cultivators in the state's established medical cannabis system to complete extensive paperwork. Adults 21 years and up can now acquire a maximum of 2 ounces of cannabis and cultivate a maximum of 6 plants for individual consumption, thanks to a law passed previously this year. But regulators are still working on restrictions for the retail sector. Just the cultivator regulations have been submitted in the New Mexico Register thus far, which on Tuesday went into effect. Shops, test sites, and other cannabis-related industries are still developing regulations, which must be completed by January 1st, 2022 in order for commerce to begin in April.
Next up, Colorado's state attorney general issued a memo to members of the U.S. Congress this week imploring them to safeguard small and local cannabis firms from being swallowed up by big tobacco and other big corporations and industries as federal cannabis policy reform moves forward. Attorney General Phil Weiser said that actions on Capitol Hill to remove national cannabis restrictions and develop a regulated model that enables states to make their respective policy choices are heartening. However, they voiced fear that corporations could eat up the sector if precautionary measures aren't implemented. Weiser expressly mentioned the Cannabis Administration and Opportunity Act, a proposal championed by Senate Majority Leader Chuck Schumer, Senate Finance Committee Chairman Ron Wyden, and Senator Cory Booker to nationally deschedule cannabis and encourage social equity. The group has requested feedback on their bill from the general populace. Senator Schumer has stated that their proposal will aim to limit the potential of tobacco and alcohol corporations overtaking the sector. The Colorado AG said that guaranteeing small businesses have the ability to join in on the cannabis sector is a top responsibility. As a result, they stated that a nationwide industry should be implemented judiciously in order to avert major corporations from dominating the market.
Last up, the Department of Health and Human Services and the California Governor's Administration are exploring if hospitals and medical centers in legalized cannabis states may enable patients with terminal illnesses to utilize medical cannabis without compromising federal funds. The actions come at the behest of a state senator who is working on a proposal on the subject. Senator Ben Wetzel of California obtained a notice for the Center for Medicare and Medicaid Services a few months earlier, asserting that there are no federal rules in effect that explicitly deal with these concerns, and he is unaware of any instances where funds have been withdrawn because a facility permits patients to utilize medical cannabis. Senator Wetzel is supporting a proposal that would make it legal for California healthcare centers to provide said therapies. Last month, they wrote memos to state and federal authorities asking about patient accessibility to cannabis. Wetzel's bill was motivated in part by the story of a parent whose child perished of cancer and was refused medical use of cannabis in a California treatment center. This session, the proposal already has cleared the state Senate and an assembly panel. It now awaits consideration from the full assembly before being submitted to Governor Gavin Newsom's office. Newsom, a legalization supporter, vetoed a previous measure aimed to confront the problem in 2019 due to the uncertainty about potential federal consequences for allowing medical cannabis use in hospitals.
That was today's Buzz. Thanks for listening. For more cannabis news and insights from industry professionals and a place to discuss these stories and others, visit trichomes.com.
And be sure to catch up with all of our other cannabis industry-related podcasts like Hash It Out, Careers in Cannabis, or the International Cannabis Conversation, wherever you get your podcasts. For Trichomes.com, I'm Devin Leon.
And I'm RJ Balde, signing off.